Hi, Dr. B here, psychiatric nurse practitioner, and I have a very special guest today I'm super excited about. This is Dr. Fleming, MD, and he has lots of experience. We're going to be talking about cognitive behavioral therapy today, but I'd like you to introduce yourself, give a little bit of background, and specifically your CBT and TMS experience.
Sure. Well, it's a pleasure to meet you all. I wish I could see you, but it's one of these things where you can just see me. I've been a practicing psychiatrist for 45 years now, trained originally as a psychotherapist, but I also do a lot of psychopharmacology. And as part of that psychopharm, I also do ketamine infusion work and transcranial stimulation work. So that's my background.
Yeah. And so how does cognitive behavioral therapy fit into this big picture? Because when we're talking about therapy, it's just, there's a plethora of words, being used and thrown back and forth. And I kind of have a mission to make cognitive behavioral therapy kind of the standard of care, and then we can put in some of those techniques as you're trained. So tell me a little bit about your ideas around cognitive behavioral therapy.
Certainly. Well, I don't want to add extra terminology, but I'll throw one out there.
Okay.
Which is evidence-based psychotherapy. Mm-hmm. And cognitive behavioral therapy has the greatest depth of information that it's actually effective, changes how people approach things. And we call it evidence-based because double-blind studies using pure cognitive behavioral therapy techniques or classic cognitive behavioral therapy techniques compared to other kinds of therapy show that CBT works best. Mm-hmm. Now, it's not the only evidence-based therapy, but a lot of times people go to a therapist. The therapist is well-intended. The therapist tries to make a relationship with you and talk to you about your problems and maybe increase your insight or maybe give you some suggestions. But the therapist will often tell you, I'm borrowing myself from a number of different trends and techniques. I may be throwing in a little bit of psychotherapy from a psychoanalytic perspective or insight-oriented therapy. I may be doing some supportive work. I might be doing some short-term techniques. I might be doing a lot of different things. Mm-hmm. The advantage of cognitive behavioral therapy is it's a consistent program that works from place to place and really encourages you to think very carefully, why am I reacting the way I am? What are my cognitions and what are my alternative strategies that I can implement? If you think about it, really, when we're talking about people who need therapy, what you can say is common is, I'm overreacting to a given situation. I may be overly anxious, I may be overly sad, I may be overly angry, but I've heard something or experienced something and it's just automatic. I'm reacting. Being able to slow that down, if you will, count to 10, and come up with an alternative way about thinking about what you just heard or what you just began to feel is essential. And that's how CBT works. So I'm a big proponent of it.
Yeah, and I always like to do acronyms because I think it's easy to remember. And so kind of like that TikTok, think, organize, choose. Whenever you're in that reactive state, stop, think, try to organize your brain, and then make a choice. Yes. That's kind of a super simplified version, and that's one of our choice opportunities.
Yes.
But I know it's been a while, but I did give you the book, and I know it's a super simplified version, but I feel like it's a solid cognitive, let's think and figure out why, we're thinking have these patterns, identify, organize, and then making those choices moving forward.
Of course, and the advantage of a workbook is you can work on it yourself. It's very clear, it's got steps, and you can put this into practice when you're not in a stressful situation. Right. I'm not saying being with a therapist isn't stressful. Sometimes it is. We can get very nervous being in the room or talking about some personal issues, being in the room with somebody, even if they're nice and likable and friendly. However, it's not as tough as being with people who trigger you all the time, whether it's total strangers or spouse. Or kids or whatever, and you get to practice your way through the workbook. And I think a lot of people that I refer for CBT start off thinking, oh, this is ridiculous. This is never going to help me. But those who start applying themselves and learning the principles really find that it can change their lives.
Right.
And here at the TMS Center, we require that when patients are getting TMS, that they be in an active form of psychotherapy. Why? And we prefer CBT. Why do we make this requirement? Well, TMS is a biological treatment that will change your outlook in about 6 to 8 weeks if it works, which it does in about 60% of the time. But you know, if you have been living with depression for many years, as many of our patients have, you've gotten used to making decisions to avoid making the depression worse. The tail wags the dog.
Right.
The illness is being placated all the time. And so even when people get the biological relief from the depression, unless they use something like CBT, their automatic responses will be the same. And what's that old saying?
Right.
You keep making the same decisions, you're going to keep winding up in the same place you wound up in.
Yeah.
And even if you're not biologically depressed, if you keep making some of those same automatic decisions, you don't stop and think and problem solve, you're not going to get as much benefit.
Right.
So while there are plenty of TMS centers around the country who just use it as sort of come in, get your magnetic energy and leave, that's never been our approach here because it doesn't work as well.
Right. And talk about the neurochemistry behind that and the new pathways that TMS is creating as well as CBT creates.
Right. Well, all effective treatments for depression do generate new connections between neurons and different parts of the brain. And from that perspective, it doesn't matter whether it's talking therapy, CBT, TMS. What does matter is the speed. Okay? When you've been depressed for 18 months, you have lost between 10 and 30% of the volume of the nerve cells in your brain that regulate mood and affect. Why have you lost it? Because those cells are not being stimulated. Cells in the central nervous system that are not being stimulated die off, or connections between cells die off. Okay? So think of TMS this way. Artificially, we're applying a fluctuating magnetic field to the region of the brain, and that region sends neuronal impulses, normal neuronal impulses, down to the limbic and hippocampus. Just like happens when you think, say, a positive affirmation about yourself. I'm good. That sends an impulse. But we'll give you 3,000 pulses of magnetic treatment in a treatment session.
In 3 minutes, right? The machine you're using is 3 minutes.
Well, with a 3-minute machine, we're using 900 pulses, but they're specially coded for the theta burst. The theta is a dominant wave in the brain. So it's like you're thinking in 3 minutes, 600 positive thoughts, or 600, I can do this differently. And it starts to put a groove in your brain. Not a bad groove. Not, we often talk about a broke skips on an old-fashioned record. Some of you may know what that is. Some of you may not. I'm dating myself. But it's like doing that successfully, rethinking over and over and over again. And so you plug together something like CBT and TMS, and now you're really cooking.
Yeah, cool. Well, thank you so much. We could talk about this for hours. I know you are passionate about this, the neuroscience and the psychology and psychotherapy. So thank you so much.
You're very welcome.
For being with us today. And we do believe that you are mentally strong.